The most common type of headache is the muscle tension headache. It's more of a soft tissue contraction headache because more is involved than just the muscles. This type of headache is effectively addressed with massage technique. The following demonstration identifies areas that you would work if you were looking to alleviate tension headache. The shoulder area up into the neck is a very important aspect. Apply inhibitory pressure at the attachments of the muscles on the scalp. Broad-based compression against the muscles of mastication, primarily temporalis, is important. Friction, a shear force, is utilized on the connective tissue bands in the scalp. Use palpation skills to identify potential trigger point areas. Apply inhibitory pressure to make sure that the trigger point is referring into the symptom pattern area. And if it is an active trigger point, then proceed. If not, move on to additional massage of the area. A common trigger point area is at the attachment of the temporalis just above the ear. This is often a common referred pain pattern that is complained of. Use trigger point methods, inhibitory pressure, and local stretching to work the area. If the person clenches their teeth, they can actually bring in contract, relax, muscle energy methods. Palpation assessment, drag palpation, indicates areas that would need attention. Once the area is identified, various massage applications can be used. In this demonstration, by having the client squeeze their eyes together and open their eyes very wide, we're able to use muscle energy techniques. Specific releases using inhibitory pressure into those muscles that refer pain into the head is important. First was demonstrated the occipital base release, and now working with the scalenes. With the patient in the supine position, we're able to work with the head as well. The same techniques utilized in prone and side lying are used in this position. If the client is experiencing sinus congestion, compression into the points indicated can help relieve that sensation. With tension headache, often it feels as if the scalp is too tight on the skull. Pulling the hair gently and moving the scalp helps relieve that sensation. Vascular headaches are much more complex than simple muscle tension headaches. Simply think of vascular headaches as too much fluid pressure in a closed container. Utilize all of the tension headache methods that we have discussed, and then add the idea of pumping or compressing, like you're pushing the fluid out of the head. This compression is applied along the various suture areas of the cranial bones. The rhythm is slow and even, and this should feel very good to the client. Often referred pain pattern from the sternocleidomastoid can mimic a vascular headache. If this is the case, use the specific release for this muscle. Gentle traction in a pumping action also assists the fluid movement. With vascular headaches, always maintain a slow and confident touch.